poster is on the impact of culture on breastfeeding outcomes and the financial impact of formula feeding in particular. So the focus areas that we're using is Asia, Africa, and the Middle East. That's because most of these are developing countries and have reduced rates of breastfeeding. So there is a lot of cultural considerations in these areas. So one of the main cultural considerations is the high rates of HIV. So women that are HIV positive are known to be less likely to breastfeed because of the fear that they'll transmit the infection to their newborn. Even though the World Health Organization says that if the women are commenced on antiviral therapy, that it's safe to breastfeed. Other cultural considerations in these sort of areas is the poor access to antenatal care and education, mainly due to the rural nature of these areas and the low developing country. So there is also quite a few religious perceptions of breastfeeding that impact the rates of breastfeeding in these areas. So one example in Western Africa is the belief that sperm impacts the breastfeeding and infects it. So women that are thinking about resuming sexual activity will often cease breastfeeding. Another example in Bangladesh and Pakistan is the belief that breast milk can become infected by bad spirits, which makes it a pus-like consistency, which we know is colostrum, but that means that they'll throw that colostrum away, which makes the initiation of breastfeeding quite low.
So as we know, there are many benefits to breastfeeding, especially exclusively for at least 6 months. So as well as improved bonding between mother and her baby, these benefits also include protection against many childhood illnesses such as asthma and cystic fibrosis, and also a greater immunity against infectious diseases. Breastfeeding exclusively also reduces the risk of many different types of cancers and type 2 diabetes for a woman. So breastfeeding is also undoubtedly cost effective. It's estimated that an average cost of feeding one baby formula for a year is $1,734 US. So this is a rough estimate. There's many different factors to consider when calculating this cost. However, breastfeeding exclusively has no financial cost at all. It's also estimated that if all babies in developing countries were breastfed, the gross national income of these countries could be increased by $1.6 billion US. So the World Health Organization and the United Nations have implemented strategies to try and promote breastfeeding and increase rates of breastfeeding around the world. So some of these strategies include improving access to education for women and girls to ensure gender equality, improving nutrition, more access to contraception for women and girls, and more understanding and knowledge of contraception, therefore reducing teen pregnancies, unwanted pregnancies, improving access to community-based antenatal care and education, promoting normal birth and skin-to-skin immediately after birth, so increasing rates of normal birth around the world, supporting paid maternity leave globally needs improvement, and strengthening healthcare systems to support, empower girls and help to implement these strategies.